my agony. Know that I will never marry. Baby, I'm just soggy from the chemo, but counting down the days to go. It's just ain't living, and I just hope you know that if you say goodbye today, I'd ask you to be true. 'Cause the hardest part of this is leaving you.
Methotrexate is one type of cancer drug that can be used against gestational trophoblastic disease. It is also known as Trexol and is classified as an antimetabolite, more specifically, a folate antagonist. This drug works in the S phase of the cell cycle by stopping the action of dihydrofolate reductase, which is the enzyme responsible for converting folic acid into its active form, folate. Folate is what is needed to synthesize DNA, and through this action, DNA is not produced, and therefore the cell dies. It can be administered in many ways, such as intramuscular, intravenous, and oral tablets. There is even a preservative-free injectable form for intrathecal administration. If dosing for intramuscular and intravenous sites, you can choose from a vial of 25 milligrams per 1 milliliter or 1 gram per 20 milliliter vials. The oral dosing of this medication comes in either 2.5 milligram or 10 milligram tablets. Side effects include GI discomfort, bone marrow suppression, hair loss, tumor lysis syndrome, which is a combination of metabolic and electrolyte abnormalities, and palmar-plantar dysesthesias, which is redness, swelling, and pain on the palms of hands and soles of feet. When using this medication, always administer high doses of methotrexate along with the drug leucovorin, which is an antidote for folic acid antagonists. Administer an antiemetic along with dexamethasone, granisetrone, or metoclopramide before beginning chemotherapy to prevent GI distress. Monitor white blood cell counts, absolute neutrophil counts, platelet counts, hemoglobin, and hematocrit. Assess for bleeding, gums, and bruising. Provide frequent oral hygiene. Instruct to avoid crowds and infectious individuals while monitoring for GI bleeds and assessing for mouth sores. Also, monitor for renal damage due to hyperuricemia or elevated levels of uric acid. Monitor kidney function, BUN, creatinine, and INO, and reduce the dosage for clients with renal disease. The advantages to the consumer are that this medication slows the growth of cancer cells, the price is more affordable than other drugs, and there are a variety of ways to administer this medication.
Dactinomycin, also known as cosmegan, is classified as an anti-tumor antibiotic, or more specifically, a cytotoxic. This drug works in combination with methotrexate. Unlike methotrexate, which inhibits DNA replication in the S phase, dactinomycin is nonspecific and interferes with cellular processes throughout the entire cell cycle. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. Usually, the drugs work by damaging the RNA or DNA that tells the cell how to copy itself in division. If the cells are unable to divide, they die. The faster the cells are dividing, the more likely it is that chemotherapy will kill the cells, causing the tumor to shrink. Always remember, the only way to administer dactinomycin is through intravenous access. The amount of dactinomycin that you will receive depends on many factors, including your height and weight, your general health or other health problems, and the type of cancer or condition being treated. Your doctor will determine your dose and schedule. The following side effects are common of patients receiving dactinomycin: low blood counts, hair loss, nausea and vomiting, fatigue, mouth sores, and diarrhea. Always remember to wash your hands often. To help treat or prevent mouth sores, use a soft toothbrush and rinse 3 times a day. Use an electric razor to minimize bleeding. Avoid contact sports or activities that could cause injury. To reduce nausea, take anti-nausea medications as prescribed by your doctor, and eat small, frequent meals.
One 2.5 milligram tablet costs $2.71 per tablet, while a 10 milligram tablet costs $2.58 per tablet. And one vial of 25 milligram per milliliter costs $58.99 per vial.
Dactinomycin can cost up to $1,284 per vial, but patient assistance programs are usually sponsored by pharmaceutical companies and provide free or discounted medicines to low-income or uninsured and underinsured people who meet specific guidelines. Eligibility requirements vary for each program. Reasons you should consider dactinomycin are: pharmaceutical companies sponsor patient assistance programs that provide free or discounted prices of this drug. It is less toxic to your liver and can be given in larger doses every 2 weeks, causing less side effects.